Just didn't want to be a doctor who hands out pills or delivers bad news to people. I wanted to do more.
The Wellness Center, or wellness concept, was birthed by Dr. Schwartz.
He's so inspiring. He's unlike any physician I've ever met, really.
Dr. Schwartz, his passion is cardiac disease, but it truly is a passion for treating the whole person.
He just sees the big picture. He's able to have this vision.
The analogy I give is we're sitting at the foot of a cliff waiting for people to fall off and trying to catch them, and the question always is, well, why don't we ever climb up the cliff?
I remember my father saying that we're the first generation that actually is armed with the knowledge on how to prevent disease.
It's been estimated 80% of our current diseases are preventable, and we now have an epidemic of chronic disease on our hands.
And I remember him looking at me going, you have that knowledge. The question is, what are you going to do with it?
The system is really good at acute care. When you get your heart attack, we can take care of you, better than ever before.
When you're his patient, it's not just about your heart, it's about your whole person.
Where it fails or where it is not able to handle it, the cost and the burden is chronic diseases that are largely preventable.
For the last 5 years, Dr. Schwartz has embraced the concept of population health.
I believe in changing from within the system. I really believe that.
Population health is a national agenda.
Who's going to change the healthcare system? It's going to be us. It's not going to be the government. It's not going to be, an insurance executive. It's going to be the practitioners.
So Dr. Schwartz convinced us to develop and implement several pilot programs that we did with our staff.
So from that point until now, we've been through a lot of pilot programs where we piloted the program internally with our own employees, and the program works.
And through the last 5 years, Dr. Schwartz has demonstrated improved health outcomes in every one of his classes.
Because we know we can do that. There is knowledge, there is evidence, there is medical evidence that this is a very legitimate strategy.
And so we began to look at how do we incorporate all of this into a wellness concept.
Our leadership within the health system not only talked about it, but actually did it. We have the research to back it, did it, here it is.
This is group exercise, room 3. Basically, it has pieces of yoga, ballet, Pilates.
Take it up 2 more.
The track direction will change each day.
Really what makes it unique within this community, there's nothing like it in the area. So we have a medically supervised wellness program housed within the Wellness Center.
The Wellness Center at Blessing is a state-of-the-art facility that brings wellness and prevention together and integrates it into the medical model. And we do that all seamlessly under one roof.
So the programming that we offer isn't just a weight loss program. It's not just coming into the gym and working really hard, counting calories, things like that. It's much more than that.
We will have nutritionists. We will have group classes that actually will be able to do some demonstration cooking.
Because most people think more about what they're going to wear in the morning by preparing their outfits than what they're going to eat during that day. Food is code. Food is information for your body. And the wrong food gives your body the wrong information and the wrong code, so it codes for disease. We're looking at probably some of the most powerful, therapeutic tools we have, you could potentially have, exercise.
We offer all varieties of classes, including nutrition education with a registered dietitian, wellness coaching with a health and wellness coach, exercise prescriptions with a certified exercise physiologist, and then a multitude of group classes such as meditation, stress management, one-on-ones with the dietitian as well. So there's going to be a very wide variety to address the wellness and prevention needs of each individual coming through our door.
Where we try to prevent illness and keep you well so you never end up in a hospital bed.
The reason that we have this center is because we knew that the program was working for folks. We had people coming off of blood pressure medications, type 1 diabetes patients who were able to decrease their insulin needs every day, people getting off of diabetes medications altogether, cutting their cholesterol meds in half, and then getting rid of the cholesterol meds altogether.
Not all healthcare systems have been really willing to put the energy into it.
This is not something that you're going to find at most health systems.
In Illinois, there are probably 5 health systems right now that have built centers like ours.
When the healthcare system has yet to change, Blessing Hospital is showing it's on the leading edge by opening this center.
So this is a new venture that the board was excited about, the ability to develop this and to look at how can we live up to our mission and improve the health of our community.
I think they get it. And I don't know if we could say that about all healthcare systems, but we could say Blessing seems to get it.
They care about us, they care about our health, they care about our overall well-being, and that also makes us better at our jobs so that we can deliver better care to the patients that walk through our door. And we can't wait to get started.
The center is designed to be the fence on top of the cliff. There's too many lives at stake.